Hello, and welcome to the May edition of Pulse, the monthly webcast produced by the Indiana State Department of Health to keep Hoosiers informed of events and health trends in Indiana. I'm your host, Matt Scotton. May is Hepatitis Awareness Month, so our guest today is Dennis Stover, director of our HIV, STD, and Viral Hepatitis Division. Thank you for joining us today, Dennis.
Thanks, Matt. Good to be here.
So starting off, can you just explain for us what is hepatitis and how do people catch it?
Hepatitis is a viral infection, 3 different types, A, B, and C, and people catch it different ways. Hepatitis A is foodborne, so when you see those signs in the bathroom that says wash your hands before going back to work, that's very important because the virus is spread through the food. B and C are viruses that are spread other ways, much like the HIV virus, they're spread by bloodborne pathogens. So if somebody contracts somebody else's blood or touches somebody else's blood or has sex with somebody that's infected, those are ways that B and C are spread.
And why do we have an awareness month for hepatitis?
Like all public health issues, it's good to have kind of a focus on that public health issue because there are several. And so hepatitis is an emerging viral infection that's getting a lot of attention due to the opioid epidemic. So a lot of folks that inject drugs are contracting hepatitis C through their drug use, and B as well.
And I've heard that a lot of people that contract it don't even know that they have it. Is that correct?
Yeah, it can be latent in your system for years and years and years. And usually if it goes that long in your system, your liver is so damaged that it cannot be repaired. We really are promoting folks getting into treatment because you can get vaccinated for A and B, and hepatitis C has a therapy that you can take and curb that epidemic as well.
Are there any particular populations that are more at risk for hepatitis?
Well, for some reason, and I think it's because of blood supply not being as secured, baby boomers are at the highest risk for hepatitis C. So they need to be tested at least once in their lifetime. I got mine this week, actually, so I'm good to go. So it's important for folks to know their status because hepatitis C can be treated, and if you treat it early, you have far better chances of living a normal life. B and A, they're vaccinations, so do that. Get the test. If you don't have it, be vaccinated and go forward.
In addition to talking to your health provider, the CDC has launched a convenient web-based tool to help people determine their risk of catching hepatitis. You can find it at the link below. So can you tell me a little bit about the CDC's new online risk assessment?
Well, it's a new tool. It's free. It's usable by anyone in the country, outside the country too, if you have web access. And it's easy. It's several questions. They just check your risk. And they go through some of the things we've talked about. Have you had unprotected sex with someone? Did you share needles with someone? There are ways that you can eliminate your risk by eliminating your exposure. So it talks about those kind of things and assesses whether you have a risk of any of the 3 hepatitis.
Okay. Well, thank you for your time today, Dennis. I appreciate it.
Yeah, that's great. Appreciate it. Thanks.
In addition to Hepatitis Awareness Month, May 19th is National Hepatitis Testing Day. So remember to ask your doctor if you should be tested for viral hepatitis. For more information on hepatitis, visit the link at the bottom of the screen. Until next month, thank you for watching the May edition of Pulse.